Failed him woefully.
Now, we have on the phone lines right now the CEO for the Konfanoche Teaching Hospital, Dr. Paa Kwesi Baidoo. Doc, good morning to you.
Yeah, good morning, David.
And thanks very much for your time with us this morning. I mean, to the medical fraternity out there, have our condolences. But, before we take a look as to how come Konfanoche doesn't have a cath lab, operating, what was done to try to save this 47-year-old emergency physician when he had this heart attack?
Yeah, David, thank you so much for breaking my virginity in terms of radio interviews since I became the CEO. You promised to do it and you've done it. So on a Sunday morning, I think around 7 a.m., I usually wake up quite early. I woke up around 4, did a whole lot of stuff. So around 7, I got a call from my head of emergency, the lay clinician, about my colleague. I'm not going to go into details out of respect for the family, and then there's confidential, some information shouldn't. So I was told about his condition. Luckily, so I got there around 7 something. The cardiology team were together with the emergency physicians were there attending to him. He was arrhythmic, so we stabilized him. And that is when it became apparent that, look, we needed to get him catheterized. We'll come to that. And that it can be done in Accra. And the reason why that can be done in Accra, again, we'll come to that. But then going by road was impossible. I mean, looking at the distance, looking at the road and all that. So arrangements were made. In fact, when I got there, the head of emergency had we needed to airlift him. So he called one of our former doctors. I mean, he's on secondment. He's the deputy CEO for the National Identification Authority, Dr. Fred Bedra. And I think together they contacted the Ministry of Defense. I think they got to the minister or the deputy, who agreed to allow one of their military aircraft to be dispatched to Kumasi to airlift him. Once we got that confirmation, I informed the regional minister about the development, because you cannot just dispatch a military flight here to evacuate a doctor without the regional minister. And he promptly gave approval that, look, we should do whatever is necessary to save his life. So that was done. The aircraft arrived. I think 3 consultants accompanied him to the airport. And then 1 specialist and 2 critical care nurses accompanied him on the flight to Accra. We were in constant touch from takeoff to touchdown. So when they got to Accra, we were told, they've arrived safely and he was okay. I think because it's a military aircraft, they landed at the Air Force Base, Bemakam. And so they transferred him. Arrangements again were made to send him to UGMC, University of Ghana Medical Center. They also have the cardiac cath lab. So that arrangements were made right from when he came in, stabilization, arrangement to airlift him, because time is of essence, or was of essence when it comes to MI, myocardial infarctions or heart attacks. So all these arrangements were made. 1 specialist, 2 critical care nurses accompanied him to Accra. Unfortunately, we got the unfortunate news later. So it's devastating, but these were arrangements that were made to airlift him. On the issue of cath lab.
Now, before we get to the cath lab, I mean, you mentioned that he was stabilized. Now, under such circumstances, speed, like you rightly said, is of essence. So how much does one have? Although he was stabilized and was airlifted to Accra, how much?
I am not a cardiologist, and I'll not attempt to be one.
Okay.
All my life, I've been a surgeon. I've been an orthopedic surgeon, now the CEO. So I'm not going to go into specifics. I can connect you with our cardiology team, who will give you statistics, expectancies, and all that. So
I hear you.
Going to go
so then let me move on to my next level of questions then. How come a big facility like Konfanoche does not have this cath lab?
David, you see, when I became the CEO, exactly 2 months ago, the first thing I did, because I've been in the system and we know for several years, in fact, I think we wrote letters to the Bank of Ghana, I think 3 years or 4 years ago. The cardiology team and through the Ghana Medical Association to get a cath lab. So the first thing I did when that was about a month ago was to contact the Bank of Ghana. In fact, you can verify when the Kumasi Ashanti branch of the Bank of Ghana paid a courtesy call me. And that was my first and only request that, look, we needed to get a cath lab. We don't have, aside Accra, I don't think there's any region in the country with it. So they agreed and indicated that I should bring a proposal for and send it to the governor. And again, within that whole period, we had the proposal. I contacted Dr. Lambert Apia, because he's a cardiologist. Together with his team, they drafted modified the letter they wrote a couple of years ago requesting for a cath lab. And we brought in the current statistics. I managed to get in touch with the governor, through influential intermediaries, and Mrs. Betty Modidrusu was so influential in this. And the governor agreed that, look, he was out of the country. That was a week or so ago, even before the event. He was out of the country, and it's something they are willing to help. So that when he came, and we had a proposal ready, because, and all this that I'm saying you can verify, you can call the Bank of Ghana, Kumasi office and find out if those were, because I told them that, look, it can happen to any of us, and when it happens, you may not get to your final destination. Unfortunately, it happened. But this is something we've been talking about, and we just did not talk about. I took an action within 4 weeks of becoming the...
Doc, tell me this. Has Komfo ever had this cath lab before?
No, we have never, ever had a cath
So
lab.
over the years, people who have had attacks, they have been dying? Is that what it is? Komfo has never, ever, ever had a cath lab before.
I am not a cardiologist, and I'm not going to go into... They manage. I don't know the statistics. As I said, I can come with my team. I don't want to give out any false statements or information. So I'm not going to go into... We have a well-trained cardiologist, a number of them, and that has been their cry. We've saved a lot of people. I have some I know. But for medical confidentiality, I'm not going to go into that. So as to the specifics, I cannot go into that.
Okay, so you said you've written letters, you've engaged with the Bank of Ghana, the governor is prepared to help. Where are you with this? Are we going to get a cath lab, set up? And how soon is this going to happen?
Let me tell you, you called me a couple of weeks ago wanting to find out about Hill Komfo, and I told you that I don't know what the fixation. Yes, it's a flagship program for Ohene, and we are all supportive of it. But if you remember, I told you that, look, Komfo was in coma, but all of our attention was on Hill Komfo, the superstructure. That's all and it's the best run hospital ever. You can check from the media. And I told you, David, that we had 3 CT scans for 2 years, 4 years, and more than 6 months. None of them has been working. I told you. Okay.
Yes, you did. You did tell me, yeah.
That has been, wait. We have CT scan that has been working at 40 or is it 60%. CSSD has been done. And all these were before I became CEO. Yet, we were like the best run hospital. We have this, have that. But those on the ground knew what the real issues were. But because of media friends, and so I told you, look, David, I am not going to be play the media gimmick, pardon my language, but we are going to work to solve the real program. And 2 weeks ago, even before this incident, we had a staff there, and I told them the same thing. I told the staff the most critical need, we don't have a cath lab, and it's going to happen to any of us, and it can happen to anybody, whether you are a laborer or the CEO or the minister or the president. But then we should all put our feet together and work. I discussed this with them 2 weeks.
That I have understood, but all your engagements with the Bank of Ghana, the governor, and all that, where are we in getting one? How much does it cost? How much does it cost? Where are we in getting one?
Good. So we have two. The monoplanar, biplanar. These are technical terms. The best one is the biplanar. It's able to do everything, and it costs between $1.2 to $1.5 million. We've done all this work. That's why I know. Because it's something myself, the team did weeks ago before this incident. Yeah, luckily, and that is it. Well, about $1.5 million together, minus the building and everything. But we have a space facility. The Minister of Health, again, has called. This is also so important to him. And he's directed the NHIA. So Dr. Victor Bampo called on this issue. And on the record, Dr. Victor Bampo, when he was, I think, NHIA, got Kolebu their first one in 2016. So we approached him, and they are also working on it. So you see, plans were even being made to get Konfanoche, the KATH lab, as far back as a month ago. You know, this one takes time. 1.5 million, we cannot equate life to money. But Konfanoche doesn't have that money sitting down. So the minister took it up when he was told, and then the NHIA and all that. So arrangements are being made to get, in fact, Kolebu, I think they have two. One, which was commissioned in 2016, wasn't working, and I think they took a bank staff there when they noticed the challenges. I think that was when the Bank of Ghana got them one. Kumasi, for the past couple of years, Konfanoche, I don't know, we didn't want to sell our issues in the media because probably they will think we are inefficient. But if we don't have it, we don't have it.
But Paa Kwesi, my question actually is, where are we in getting one? Because whilst we wait, people will still die if people have heart attack as we speak. So with all your engagements, with all the engagements, what assurances have you been given? When are we getting one?
David, I had a meeting with the minister and then HI boss. That was yesterday, again, on this issue. Okay? So I cannot tell you yesterday, today, or tomorrow. Give me a week. By then, I'll know the specifics, and I'll tell you. Again, if you've known me, and you've known me for how many years? Several years.
Yeah.
Whenever I don't have the facts, okay, I don't give information because I want to please the public or no. I always, as a surgeon or as a doctor and as a scientist, you always want to give as accurate information as possible. And so I cannot tell you yesterday, today, or tomorrow, but I told you the ministry is working on it. NHIA boss, Dr. Victor Bampo, and the team are working on it. In fact, this morning they are having a meeting to make sure we have one again in Kolebu, one in Kumasi, and one in Tamale. And it's a matter of urgency. It's not only that. We need total retooling. I told you, see, we do firefighting. When this one comes, we take it. But then you come to Konfanoche, central sterilization, where we make sure we sterilize our thing, has also broken down for several years. We need comprehensive retooling of Konfanoche. Yesterday, when you engaged me, I told you that, David, you can send your team, and I've told every staff member that they should go around and let's see the things that are working, that are not working. Is the hospital what it has to be? Because I didn't want to tell them this, it wasn't working. And they know. I said, when they go around and identify the problems I have identified, then we sit down. But I told them A, B, C, D, so that it wouldn't be like it's or was a propaganda. I gave them specific, check this, check that. And I gave them the assurances that, look, within 3 months, 6 months, we will work together to fix everything that is not working. And this, again, you can verify. That was 2 weeks ago when I met the staff at the staff there.
So, Paa Kwesi, for want of time, let me ask two quick questions. So, let's say, for example, this KATH lab is in existence, and somebody has to go through a session or treatment. How much does it cost?
David, you see, when they do it, it costs about $8,000 to $10,000.
If they do that treatment alone?
Sorry, yes. It's not cheap, and probably it's even But if it's in the government facility like Konfanochi, it's going to be way cheaper. And you see, most of the people who have it is private led.
But if a private institution can have it, how much more a public health facility that serves the northern parts of Ghana and even beyond the borders of Ghana? Now, you mentioned that you have only 3 CT scans that are working at 60%. I don't know whether you have MRIs and all that. I don't know the state Konfanochi itself is in right now.
I told you, I don't want to use the word we are in ICU because people think, it's a phrase people commonly use. You can come or send your team. I'll conduct you around.
I hear you, but
for you to see the states in which Konfanochi is. And you see, I told you all the time that, look, this media flimsy and all that, we should be realistic and know exactly what the issues are.
Paa Kwesi, do me a favor. Paa Kwesi, do me a favor.
David.
Do me a favor, Paa Kwesi. Please get me a team of cardiologists. Let's say for a show tomorrow. Let's see the conditions under which they work. Because if we don't have this cath lab and one doctor, a physician, emergency physician has died, I'm wondering how many more people have died. Let's have them in the studios. Tell us what conditions they are working under and what this cath lab will do. Can you assure us? Get us some people for a show tomorrow.
One, you see, again, get us cardiologists and do that. I'll have to find out what their schedule is because, as I indicated, time is of essence.
Yeah.
I'll have to contact them, find out. It's not everybody who can go on radio. And as the chief executive, I cannot order or instruct somebody to go on radio. I will need to talk to them, find out if they are not engaged. I mean, if they are not on duty, if the person is on duty, I cannot instruct or go to multimedia or any media or do that.
No, but if you look at the emergency, if you look at the situation we find ourselves in.
David, if you let me finish, we can talk about me engaging them to find a suitable time. But if you say I should get you a team of cardiologists for tomorrow, I cannot assure you of that. But if we engage and the time that is suitable for them, because to make sure they are not on duty, they are not doing procedures. It's not only that cath lab, they do a whole lot of things.
I hear you.
So
I hear
cannot give that assurance.
Eugene has a question for you. Eugene.
Doc, you see, listening to you about the media frenzy, Hill Konfanochi and all that, is that not the very issues the Hill Konfanochi was supposed to address? Because if you listen to the speech of Otuntu on that day...
Into that. As I told you, David knows where I'm coming from. That's why I use that analogy, not to tell you it's not important and all that. David understands this. It's important. But I indicated that whilst we were, now it was the structure and everything, whilst we were thinking about it, other equally important areas come to our labs. Basic things, are they working? The radiology, that's what I mean. Not to implicate that, Hill Konfanochi wasn't, no.
Yeah, Doc, I get you. But my point is that David understands, but not the listeners, because the impression I get as a listener is that we are trying to poo-poo the Hill Konfanochi project, because let's assume the Hill Konfanochi was focusing on the structure. It didn't stop the hospital to also focus on other things. So internally, Konfanochi cannot say that because of the Hill Konfanochi, they were blind to certain things. So that's why I want that clarification for you. Because if you say David understands, David is just one person. There are millions listening to you now. They may not understand, but the impression you create out there is that you are poo-pooing the Hill Konfanochi initiative.
Listen, I'm not poo-pooing anything. As I told you, if you listened to me well, I said the focus was so much on that to the neglect of other equally important services. That's what I said. I am not poo-pooing. You see, the media has tried severally to drag me in to find my views on it and everything. That's why I said David understands. So I'm not going to go into that discussion. But if you listened to me well, I indicated that, look, whilst we were there, that is a long-term project which we all support and we will support. In fact, I paid my tennis club, Ashanti Tennis Club. I made sure we all paid. Every organization or society or group I belong to, I championed it and made sure they paid. You get it? That's how important it is to me, even before I became the CEO. But what I indicated was that whilst we were on that, things like radiology, things were like labs, things like getting a KATH lab. We were not focusing that much. I wasn't the CEO. I wasn't in management. Top management. So I can't speak to what the vision or policy or our priorities were. That's what I'm saying. So I respect the listeners. I respect you as the journalist, and I'm not going to poo-poo any meaningful project. In fact, we'll be coming back to you on this same project. So how can I poo-poo a project that is so dear to every Ghanaian?
But Paa Kwesi, you know what? Paa Kwesi, do me a favor.
And we will support it 100%.
But Paa Kwesi, you're saying that we have this cattle lab only in Accra, Korle Bu, and UGMC. Korle Bu, Confanoche doesn't have, Tamale doesn't have. If we don't talk about this with speed and urgency, I'm sure we will not get it. So please, let's get some members to join us and have a conversation. Let's understand what they go through. Because lives are being lost. And this is the time. If gain some momentum, let's ride on the momentum.
David, I've seen your enthusiasm. We share the same passion. And as I indicated, I have given you what is happening.
I understand.
The steps we've taken. And it's the momentum. But as I indicated, in fact, today, if I am done with the show and I will call, what I indicated was, you said I should give you assurances that they will be in the studio tomorrow. And I said I'll need to find out availability. Yesterday, you called me that I should grant this interview. I was on my way driving from,
I know,
on the Accra highway, I told you, but I stopped out of respect because when I saw your call and you forwarded the thing to me, and I stopped back at a safe place to engage you. That is how important these issues of health, issues not only in Confanoche, but health in general.
I hear you.
To me.
So
I noticed that it was so important. These are important things. I packed. They will always tell you when you are driving, don't pick your call. But when I saw your message and all that, I made sure I packed at the next safest place and I called you. Didn't I? I did.
Yes, you did. Yes, you did.
And I promised that this morning I'm going to talk to you. In fact, there was another program, but I told them we had a Zoom meeting on some of these things, that implants and things that has not been. And this was arranged about 2 weeks ago, and it was to start at 6:45. But I told them, look, I needed to address this issue at multimedia, so we should rather send it to like 7:30. So when your producer called me, I told him if we can. He said, he was calling me back in 5 minutes. I said, I have another program. So if you could kindly call now, and that is how come we are speaking. So it's very important to me, just as it's important to you. So once we have the momentum, I promise to talk to the team. Okay, if from here, I will, just like yesterday when we spoke and I've honored it, and I've always been a man of my word.
Indeed, you have. Paa Kwesi,
yes.
Thank you. Thank you very much. I appreciate your time with us. I'm grateful.
You're welcome.
But you still owe me a studio interview for us to talk about Confanoche in total.
Yeah, David, I promised you, and the reason why it hasn't happened was I wanted to know all this. These are all the things, and I told you we are in more serious crisis. You remember?
I do, and so you're gathering stuff. So continue gathering them. When all is said, we'll have that conversation in the Studios of Love 99.5. Dr. Paa Kwesi,
don't worry.
Dr. Paa Kwesi Baidoo, I know you promised that you keep it. Thank you very much. Dr. Paa Kwesi Baidoo is the CEO for the Confanoche Station Hospital. But I think for this position, he's going to relinquish that one. I need to find out. But listen,
but I said the one at was still the national.
Listen, this song I played. Hold on, this song I played earlier this morning. I want to play it again.
Michael, eles não ligam pra gente.